as I told you, the tools number one is called Maslow hierarchy. Means what need is first most priority or most important. If I have a pain, the most priority pain medication. If I feel hungry, food is the must first priority. If I have a shortness of breath, the respiratory clearance is the first priority. If you see my oxygen level go down, give them oxygen is a must priorities, right? And all of them are physiological. So when I have enough or I feel fulfill my physiological need, then another need will come. So the Maslow, first of all, need the most priority the physiological needs or survival needs. So if I talk about our daily living system, I said, so like what we need food, right? When you have food to eat, then you will look for shelter or home to live there. So after food, you have to look for the shelter. When you have food, when you have the home for the shelter, you have to look for love or belongs to love, right? But it is going to talk about the normal daily life. What about the patient when they come to got hospitalized? If patient got hospitalized because of pain, give them pain medication, the most priorities. If patient got hospitalized and you can saw the oxygen level is go down, then give them oxygen. This is the most priorities, right? So in the law or Maslow law, we can see the most important things is the physiological need. So physiological need include oxygen, water. So if you feel thirsty, what you need? Money. Is it possible money can um, fulfill your dehydration? No, you have to need water, right? So water, food, and elimination. So suddenly you feel you have to go to the toilet for urination or defecation. You are driving in I-94 5. What you do? You have to stop by and you should look for where is the 7-Eleven, right? Or Walmart to look for the toilet facilities. So elimination is the most priority. If even I can tell you, if you have too much pressure for urine or defecation, if you do not get anything, you look for the forest, right? So you see how important it is. So we feel our society, our ego, but when you feel hungry, you do not think anything. You have to buy food and eat. What about the condition does not care? When you have a need to eliminate the bowel or urine, you have to go wherever it is, right? Because it is your physiological need. So when you have enough oxygen, water, food, shelter, and bowel elimination, then go for other need, right? It is called securities need. So protection from harm. So if you go here in Florida, you see some rich people living in some community, and other people are not allowed to go inside because rich people also think about their safety. They think somebody come and kill them, snatch their money, and they buy the house in gated communities because they have enough money, they can do it. But you, me, we do not care about our safety. We are fine, right? We are so good, thanks God, we are healthy. So I said, when you have enough, or you can fulfill the all of the demand, you have to go for more security. First security is the shelter or home or house. But when you have enough, then you have to look for gated community because of the safety, right? Protection from harm. And also, when you have all of them, you need the belonging needs. Belong needs. You have to have the love. Is it possible to stay alone without love? Oh no, right? You should die. You don't want to stay alone without love. So if we go in the forest, is it possible you should live in the forest alone? No, right? You need someone. So belongings is need, love, affection. You want to share your emotion because of mental peace. But don't give your heart someone. They can bite your heart, eat your brain, leak your memories. So it is important to choose the most perfect person, right? So when you have this physical need, society, I mean security enough, belongs, then what you need more? You need esteem, wealth, and finally you need the self actualization, some ego come. So I said the why it is important for your nursing science, because this is the model what we need for society. But this model, same model, we can use when we give the treatment to the patient, right? Like you have a 4 patient. One patient has a less oxygen. Another patient is little bit minor injury on the legs. This patient will not die, but the patient who need oxygen, if you do not give them oxygen, they will die. So give oxygen is the most important. So we can apply this Maslow. When any prioritization question come in NCLEX board, we have to apply this law to find out which patient who need most important response, which patient you go first. You have to categorize according to the Maslow or A, B, C, D law. A, B, C, D law means A for check the airways. If the airway is obstruction, clear it first. B for check the breathing. If any kind of asphyxia or obstruction in the upper respiratory tract, you have to correct airway and breathing first. Then go for C. C for circulation. If patient have any kind of active bleeding, you have to stop the bleeding. You have to check the pulse rate, blood pressure, check for shock, circulatory. Then go for D for any kind of disabilities. Any kind of disability, if there, you have to remove your patient from the source of harm, right? So when you go and check, or if you in NCLEX book, if you go any question for prioritization out of 4 patient, which patient you have to check first? You have to apply your knowledge, either Maslow law, or you have to apply A, B, C, D laws, what we discuss